Welcome to the 92nd Streetwise very first Women's Health Summit. We've convened leading doctors, experts, authors, and more to equip women and girls with the knowledge and power they need to lead their healthiest, happiest, most fulfilled lives. I want to thank our sponsors, our title sponsor, the Katz Institute for Women's Health, and our media sponsor, Town & Country Magazine. This week's summit will explore the most essential things women need to know about health and wellness and provide advice on how to take the best care of ourselves. We'll find out about the most interesting new approaches to physical and mental health, and we'll examine important topics like cancer prevention and innovation and brain health. 92Y is proud to present this week-long summit as part of our long-standing commitment to uplifting women and girls. Thank you for joining us.
Good afternoon, everyone, and thank you for joining us today at the Women's Health Summit. I'm Dr. Stacey Rosen, the Senior Vice President for Women's Health at Northwell Health and Partners Council Professor of Women's Health at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. I oversee the Katz Institute for Women's Health. The Katz Institute is thrilled to collaborate with the 92nd Street Y to present this week's Women's Health Summit, which would not be possible without the generous support of Nancy and Larry Roth. We thank them for their continued support of women's health because events like this are at the core of the Katz Institute's mission. We aim to make women better advocates for themselves by sharing knowledge and resources, and that is exactly what this week is all about. We're dedicated to raise the health of everyone in our community. This includes raising the standard of care for the 51% of the population who have been underserved, underrepresented, unseen, and unstudied for so long. At Northwell, we know that your health goes beyond physical well-being. We focus on communities, and we know that taking care of you means getting out of our hospitals and medical offices and addressing larger societal issues. Historically, the model for healthcare, for research, for clinical practice has been man. Men shaped medical research, medical standards, symptom definitions, diagnoses, and even treatments. And the assumption was that women were simply small men with pesky hormones. But women are not small hormonal men. Every cell in your body has a sex, not just the parts covered by a bikini. At the Katz Institute for Women's Health, we reject this dated approach by building a network of experts devoted to every aspect of a woman's health. Our clinicians and researchers create women's norms, women's needs, women pattern of health and disease to deliver women-centered care across all stages of a woman's life. We not only see women's health differently, but we have the expertise to treat women differently, meaning prevention, diagnosis, and gender-focused treatment options. And this couldn't be more important because we also know that women are the chief medical officers of their homes. That means that healthy, well-informed women lead to healthy, well-informed families and communities. Throughout the Women's Health Summit this week, you'll hear from women's health experts on a number of important topics, including brain health, OBGYN health, and heart health. We're starting today with mental health, which has become a very important concern for so many of us over the past 15 months. The pandemic has added stress, isolation, and fear into our everyday lives, and this has had a real, tangible effect on our well-being. So today, we're going to discuss the effects that stress can have on your mind and body, and hopefully provide some tools so that we can all get through this together. I look forward to continuing the conversation around women's health throughout the week, and I'm honored to moderate the first panel today. Thank you very much. Good afternoon. I'm Dr. Stacey Rosen, the SVP for the Katz Institute for Women's Health at Northwell. I'm excited to be moderating this panel discussion with 3 experts who will share their insights on what women need to know to empower themselves with the knowledge to make informed decisions about their health and wellness. I am a practicing cardiologist at Northwell and have been here for quite a while, focused completely on women's heart health. Allow me to introduce Dr. Nancy Beran. Nancy, could you tell us a little bit about yourself?
Sure. Hi, everyone. I'm Nancy Beran. I'm a primary care physician, and I'm board certified in internal medicine. For the past 20 years, I've been delivering primary care primarily to women. I have a medicine for women practice in Westchester County, New York. Additionally, I'm the chief medical officer of an ambulatory group that's part of Northwell called Westchester Health, where we have over 90 providers, both physicians and advanced practice providers, and we lead a lot of ambulatory quality initiatives where we work on improving patient-centered care.
Thank you. Dr. Monique Jones, could you introduce yourself to our audience?
Sure. I'm Monique DeFord Jones. I am an obstetrician gynecologist by trade, and I am the Associate Chief of Labor and Delivery at Katz Women's Center over at LIJ. I've been part of the health system since '89, where I started my residency here and had a solo private practice, and now back as the Associate Chief. I work with our obstetrical patients here on Labor and Delivery, providing care for all of our women here.
Wonderful, thank you. And finally, Dr. Nina Vincoff, could you introduce yourself, please?
Yes, of course. Hi, I'm Nina Vincoff. I'm a radiologist. I specialize in women's imaging and particularly in breast imaging. I'm the chief for breast imaging for Northwell Health. I oversee our breast imaging across our entire health system. And I'm also within the Department of Radiology. I'm one of the vice chairs specifically assigned to oversee patient experience and making sure that patients have a positive experience while they're having imaging exams. I'm super passionate about women's health. Before I decided to become a radiologist, I thought I might be an OBGYN and have always subspecialized in women's imaging.
Terrific. So I'm sure everyone will agree that when it comes to staying healthy, women often put their health needs last. We're always too busy. We manage work, family, everything else. And it's always, I'll think of me last. But the truth is, we're here this week because it is time for women to take their own health as a priority. You know that when you get on an airplane, you're putting your oxygen mask on first to help others around you. And if you don't take care of yourself and learn how to really be an empowered patient, your family won't stay as well. You won't stay as well. And, we know that women are also the chief medical officer of the home. So if we empower our women to take care of themselves better, that will sort of cascade down to taking care of your family and even our communities better. So let's start. Dr. Vincoff, we tell women that they should come with a personal health inventory. I joke with family members that you would never come to the accountant before tax week with no paperwork. Everything comes with you. But we often will go to a clinician, a doctor, and not have our stuff. So what does it mean to have a personal health inventory? I know that having a family history is a priority. How do you acquire and put together that information?
I think this question really gets to the heart of how to be an effective partner to your physician and how to advocate for your health. When you go to see your doctor, any kind of a doctor, they have a limited amount of time that they can talk to you. And while they want to personalize your visit, they have a limited amount of time to assess what your personal risk factors really are. Your family history has lots of information about you. And when you get to your doctor's office, they will probably give you forms to fill out with your family history. But unless you've done your homework ahead of time, it's very likely that there's going to be holes in that information and it's going to be incomplete. And your doctor can only do as good a job as the information that you give them. So it's really important to take the time before you get to your doctor's office to do that inventory, to collect that family history. And collecting a good family history takes time. It's complicated. It can sometimes be uncomfortable. In order to have a really good family history, you need to ask kind of probing questions to a lot of members of your family. You want to go to not just your immediate family, not just your siblings and your parents, but you want cousins, aunts and uncles, and grandparents, And as women, we tend to think about our family history as being on our mother's side, but you need to know the family history on your father's side as well. The kinds of things that you're going to need to ask in this conversation may take a few tries, and some family members may not be comfortable answering these questions the first time that you ask them. But the kinds of questions that you want to ask are, for those relatives who have died, how old were they when they died? And what was the cause of death? Who's had cancer in your family? And that can sometimes be a more difficult question to answer than you would think. Sometimes family members will know that someone in their family had what they will call bone cancer or brain cancer or liver cancer. But what's really important to know is that where the cancer started, or did it start somewhere else? Did it spread to the bones? Did it spread to the brain or the liver? The important thing to know is what types of cancer did people have when they were first diagnosed? And that's on both sides of your family, not just on your mother's side. You also want to know things about genetic testing. Has anybody in your family already had genetic testing? Or are there any diseases in your family that are known to be carried genetically? And then you want to ask the questions about all the other things besides cancer that are important for your health. So you want to ask about hypertension, about heart disease, about stroke, about diabetes, kidney disease. You want to ask questions about mental health and substance abuse. Those are important things to know. And then you also want to ask questions that might seem obvious, but you want to ask questions about the ethnicity of your family. You know, you may know about your immediate relatives, you may know about your parents, but you may not know about your grandparents. And they're important questions to ask, even if you're not a religious person. For example, you may have Ashkenazi Jews in your family who may actually be putting you at risk for certain kinds of diseases that you might not be aware of. So these are hard questions to ask. They can be uncomfortable questions to ask, and they're best asked long before you get to the doctor's office when you have time to ask them the right way.
No, that's great advice. And when we talk about that personal inventory, I think that is such a critical and yes, and even knowing what cancers can be hereditary, what, you know, as you said, not just grandpa had cancer, and to move from that. So empowering us to ask the right questions and doing it over, over a time period to get the maximal amounts of information.
Maybe go online to get one of those family tree programs where you actually draw out your entire family, and as you get information, fill it in. You might not get it all at once, but keep it somewhere, and as you learn new things, fill it in.
That makes great sense. And as you've done the work, you then get to share with siblings and other family members. It's great advice. You mentioned that we know that doctors' visits, our clinical time spent with our doctor face-to-face gets shorter and shorter, and keeping track of all of these things really allow us to maximize the visit. But so Dr. Jones, how do we prepare for our annual visit? You know, again, if it's a short time period, what's the best way to come and really make the most of our women's wellness checkup?
So the best way to do that is like what Dr. Vincoff says, you want to come prepared. So you want to have a list of those questions that you want to present to your doctor and be able to ask them, so that you make sure that you hit all your target points that you want to address. It's also important, if you're on any medication, to come with the name of your medication and your dosage. You find the patients will come with their medication but may not know the dosage. Or they know they're taking a pill and know the color, but not know the name. So it's really important that you have the name and you have the dosage. But what's also important, you know, besides having your family history, like Dr. Vincoff said, is for some people, they get nervous when they go to the doctor. So it might be helpful if they bring a support person with them. It can make the exam a little easier. And from a gynecological standpoint, one of the things that we do recommend is, if you are coming for that gynecological exam, it's important that if you're having your menses, to try not to come for the exam, because it can obscure some abnormal cells that may be present. But also try to avoid douching and any insertion of any kind of vaginal creams. So from a gynecological standpoint, you know, you may need to reschedule that appointment, but when you're making that appointment, you know, or you're rescheduling that appointment, you want to be able to tell the front desk why you need to reschedule, not that just that you're canceling that appointment.
No, that's perfect. Dr. Beran, as an internist, are there other pieces of information you want to, advise our audience?
Yeah, so I think, when you're choosing a doctor, you really want to have confidence in that doctor. You want to make sure that they're well trained, that they're board certified. So if you're looking for a primary care physician, you want someone who's board certified in internal medicine or family practice. You want to check out their credentials, because if you don't have confidence in what they're sharing with you, then you really can't have a valuable relationship. And then I think you need to know, does this practice work for my life? Whenever I need a new patient, I go through, I introduce myself, I introduce my relationship with my partners. I tell them how to get a hold of us if they're sick, how to get a hold of us if it's just a routine thing, what our hours are. Does that work? Does our approach to patient care mesh with what you're looking for from your doctor? It sets expectations right off the bat. Also, if you're going to read comments online about a physician, pick a validated source. Many of us participate, all of us at Northwell participate in, we survey every patient who sees us, and we post those comments through Press Ganey onto our website. So you can read the good, the bad, the ugly, about a physician before you go. And it's really, we are very transparent about it. But if you're reading online sources, read validated online sources. But most importantly, I think it's really about the connection. Do you feel comfortable with the doctor? Do you feel like you can tell them can you share the highs? Can you share the lows? Can you bring your concerns? Do you have a rapport? And I think if you have those things, then you can really tackle and have a good partnership and work together to improve your health.
It's funny that you mentioned about, valid sources for this. I'm often, as a cardiologist, I'm often referring to cardiologists who do procedures, cardiac surgeons. And my least favorite question is, who is the best? And there are so many of the best. And as you said, and I've been telling patients for years, the physician with, the appropriate training, the appropriate technical skills, if it is a procedure, but then somebody who you really feel comfortable with. And for us who have longer term relationships with patients, then that becomes even more important. What do you tell women who find themselves unhappy with their relationship with their physician? Women have a tendency to be too quiet with the doctor's office and embarrassed to advocate for themselves. Any thoughts from any of you on how a woman should manage if she's not perfectly satisfied with her relationship?
I think it's important that you be satisfied with your relationship. And just because you're assertive doesn't mean you're rude or aggressive. And it's important that you ask questions until you get a satisfying answer. If that's off-putting to your physician or provider, then you probably need to think about someone different. And I don't know, but I'll help you find the answer is an acceptable answer. There are times that I have a patient that I really am at the end, I don't know what's causing the problem, but I do validate their concerns. So you want someone who hears your concerns, validates it, and says, we're going to figure it out together, not someone who says that's nothing. Even sometimes, people come in with concerns that are minimal, but we need to hear why they're so concerned about it.
I think we all agree that much of the challenges with women's healthcare over decades has been just that. It's all in your head, dear, or a concern of clinicians not giving patients the time to be heard.
I meet women sometimes who it seems like they don't want to cut the cord from a relationship that really isn't satisfying them when it comes to their physician. I mean, I'm a radiologist, I can't be your doctor, but I sometimes have patients say to me, I wish you were my doctor. And I say, that's flattering, but what it really tells me is you're not happy with your doctor, and you should find a doctor that you feel comfortable with. It can't be me, but if you're not comfortable with the one that you have, you don't have to stay with a doctor that you don't feel comfortable with. And, that's okay.
And physicians' practices change, right, Monique? My physician who delivered my children is still primarily focused on obstetrics. I am far past that age. And I said to her that I would feel more comfortable with somebody who, specializes in midlife women's stuff. Do you see that as well?
Yes, that's very important. Like we all said, you have to be comfortable, because at the end of the day, it is your health and you're taking ownership for it, right? So there are times where you may need to say, hey, would you like to go for a second opinion? Or like you said, and I can even suggest somebody for you that I think you may be comfortable with. Because like you said, if somebody's going off doing deliveries and you need more care with GYN concerns and questions, you don't want to feel rushed. So you want to be very comfortable, especially with sensitive questions around, women's health, that you have the right connection, because you want to build that bond, because that's what makes for a healthier person.
No, that's perfect. Thank you. And I remind some patients when they're unhappy with another clinician who they see, that they would never accept this for a family member. If it was for a child, they would dismiss that doctor immediately. So we need to do the same for ourselves. It's not over yet. Let's talk a little bit about COVID-19 and its impact on health access, health care. We've certainly come very far from where we were a year ago, but still. Many women are delaying routine care, whether for managing chronic conditions or certainly for getting annual or semi-annual screening. And we're starting to see the harm of this. And Dr. Vincoff, I'm sure in the mammography world, this is something that you've seen quite a bit of.
Yeah, I mean, listen, we had a difficult year last year, like a lot of, different specialties. We decided in the early days of the pandemic that for non-urgent studies for screening exams, and that includes mammography, that we were going to pause for a while we figured out how we could deliver care in a safe way. And also, while we needed to divert resources, quite frankly, to people who were acutely ill. And so we were closed for screening mammography for about 2 months, from the middle of March until the middle of May here at Northwell. And if you had spoken to me last summer, I was really worried. My best guess was that we were going to be down somewhere between 25 and 30% in mammography, because even when we reopened in May, I wasn't sure how quickly women were going to feel comfortable coming back into our environment and having an exam that's very intimate. And even though we knew that we were providing it safely, there was still a lot of fear around being in such close quarters with other people. But luckily I was wrong. It ended up being closer to about 12% that we were down in screening mammography last year. In a normal year across Northwell, we'll do about 87,000 screening mammograms. In 2020, we did about 77,000. So we were down about 10,000 mammograms. But one of the things that worries me about that is that of 10,000 mammograms, you expect that you're going to find about 50 cancers. And what I was afraid of, and what we unfortunately have seen a little bit of this year, is those are people who have been delayed in reaching care. So not all of those 50 cancers, but a number of them have been women that have come in with cancers that were more advanced, larger, and more difficult to treat than they would have been if they had come in for the time that they would normally have had their mammography. Luckily, now we're finding in 2021, though, the upside, the happy news, is that things feel pretty normal here. We're back to seeing our normal patient volumes. I think that we've done the things that we need to do to make patients feel comfortable in our office, even having this very close quarters kind of a study. And I feel really hopeful that we're back on track. And anybody that didn't come in 2020, I'm out there every day encouraging them to please come in now. Sometimes women feel guilty, they miss their mammogram, and then the more times that pass, they feel even more guilty that they missed it. No guilt for me. The day you come in, that's a good day. Come in today, that's fine.
I think women think their doctors will be mad at them, or
no, never.
They'll be, embarrassed. Dr. Jones, Dr. Beran, chronic conditions. Did you see women not coming in and chronic issues becoming more worrisome?
Yes, definitely, especially with relation to pregnancy as well. People who had underlying comorbidities like diabetes and hypertension, because they were not making their appointments to see their primary care physician. By the time they did get to us for their obstetrical care, their blood pressures may have been a little more elevated, or their finger sticks a little higher than we would have liked to see for the initial start of pregnancy. So it did require some work to get them back into normal ranges.
we've seen the same thing with chronic conditions as well. People with diabetes or hypertension that have missed exams. We worked really hard to try and get everybody back in and back on a regular cycle. We're finding the drop off similar to Dr. Vincoff in well exams and people trying to get rescheduled for their well exams. And when you miss your well exam, we miss opportunities to diagnose hypertension and diabetes, to make sure that you've had the pneumonia shot and the tetanus shot and all the things that we can prevent that keep you healthy. So I really encourage people to come back in for their primary care and their well exams, because I think it's super important, especially as we head into a more open, probably fall, where we may see flu again and we may still have COVID around. We want to make sure that we protect everybody in the best possible way. So it becomes that much more important to everyone to keep getting their routine care.
Wonderful. Yeah. And again, the take home message of you are worth it. You should be scheduling the appointments. We won't be angry with you if you come in, a little past the year mark, if it's for an annual checkup. So please, we have to talk a little bit about the COVID vaccine because there's so much conversation. Dr. Vincoff, I read somewhere about possible side effects with the COVID vaccine and interfering with mammography. Is there validity or accuracy to that?
So, one of the really unfortunate things that happened with the COVID vaccine is right at the time that we were all finally starting to feel comfortable and we had this vaccine and things were starting to feel a little bit more normal, all of a sudden in the news was your COVID vaccine could be confused for breast cancer. So I just want to explain to everybody exactly what the COVID vaccine does and what it doesn't do. So the most important thing for women to know is the COVID vaccine has no effect on your breasts. The COVID vaccine doesn't cause breast cancer, and it doesn't cause anything that looks like breast cancer in your breasts. But here's what the COVID vaccine does do. Like a lot of vaccines, like the flu vaccine as well, the COVID vaccine causes an immune response in your body, and that can cause the glands, the lymph nodes underneath your arm to get enlarged. We've seen this over the years with lots of different kinds of vaccines. The COVID vaccine causes quite a whopping response in a lot of people. That means it's doing its job. Right? That means it's helping you so that you're going to be able to fight COVID if you're exposed to it. But what it can mean is that the glands underneath your arm can get quite large. And because of the way mammograms are positioned, we sometimes include that tissue on your mammogram. So we can sometimes see those enlarged glands underneath your arm. We know how to deal with this. Enlarged glands under your arm can be a sign of breast cancer, but we know that most of the time they're not. And in our practice, and I think in just about every practice now, we ask every patient before they come in, did you have a COVID vaccine? And in which arm did you have the COVID vaccine and when? And if we happen to see that you have enlarged lymph nodes on that same side where you had the vaccine, we know that's okay. It will go away over the course of the next weeks or months. If you still have enlarged lymph nodes there that don't go away after a few weeks or months, then we can have you come back in and we can evaluate and we can make sure that nothing else is going on. But it's not a reason to avoid having your mammogram. And in fact, in our practice, we are not telling people to delay having mammography. We know how to handle the fact that you've had your COVID vaccine. On the other hand, if you or your physician would rather wait, there are some recommendations out there that people wait 6 weeks. Just please, if you choose to wait the 6 weeks, come in afterwards. Don't let 6 weeks turn into 12 weeks or 6 months or a year. One of the things I've been so worried about is that we were just getting on track and getting everybody back to have their mammogram, and then we're going to lose them again because of the COVID vaccine. So 2 things. Yes, have your mammogram. Yes, have your COVID vaccine. Don't put off having your COVID vaccine for your mammogram. Don't put off having your mammogram for your COVID vaccine. Both are important. Please have both.
Perfect. Thanks, Dr. Vincoff, for clarifying that. So now I have to turn to Dr. Jones, and I'm sure you know what I'm going to ask you. There's been a lot of confusion out there, particularly of late as the younger adults and teenagers are now eligible. Is there any concern about the vaccine's impact on a woman's fertility, her ability to conceive? And then, of course, the second question is vaccination during pregnancy.
Okay, so as you said, the controversy is very, it's very prevalent and it's all over the news, as Dr. Vincoff is saying. So To date, there is no study specifically evaluating the COVID vaccine in pregnancy and in lactating women. However, the American College of Obstetricians and Gynecologists, as well as the Society for Maternal Fetal Medicine and the National Academy of Medicine, strongly recommend that pregnant women get the COVID vaccine. We do know that while the clinical trials were going on, women inadvertently were pregnant during the trials and went on to successfully have pregnancies and deliver without any complications. So we are in the midst of doing these clinical trials now with respect to the vaccine and our pregnant women. We are, we have some studies underway here at our Northwell Health System as well. We are also seeing that people who are getting the COVID vaccine, post delivery and who are lactating, they are passing that immunity on to their babies. So that is extremely important. And the pediatricians are happy as well. Wow. So we do know that with these trials that are going on and what has happened in the past, that we do see that COVID vaccine is promising and that we are highly recommending this to all of our pregnant women.
Fabulous. And the concerns that I've heard from mothers of, adolescent, maybe just starting to menstruate, younger women and teenagers are any concerns about subsequent fertility. Seems to be a question out there that I'm hearing a lot.
So with respect to fertility, at this point, we are finding that people are getting pregnant without any difficulty, the same statistics as it was prior to COVID. So there is no issues for both females as well as males for fertility issues from both sides. Because I know sometimes the men are concerned, will they also have decreased sperm counts? And right now the answer is no.
No, that's perfect. Thanks for sharing that information. The COVID-19 pandemic has certainly brought health disparities and the importance of health equity to the forefront. We've seen like never before that racial and ethnic minority groups really continue to have lack of access both to quality care and to culturally appropriate care, and their outcomes are poor. I would argue that for women's health has historically been underserved, not being studied, having challenges with access, particularly to physicians, clinicians who really understand their needs. And this has been an enormous issue. There's been a lot written about how COVID has been much of a harder situation for women, both professional women, women taking care of family at home, and it's not going to be solved overnight. But Dr. Beran, in relation to what you spoke about on empowering women to be really, demand and expect the care that they need, what do you think women should be aware of?
I think this is a really interesting time for women, and that we recognize that women have not always been studied and treated the same way. So it's a completely reasonable to expect and demand that we get the treatment that we need, and that you get the care that you need, that you get your questions answered, that you don't feel intimidated or uncomfortable advocating for yourself. And I think that that's the key. So while you're re-entering healthcare, or if you haven't left, make sure that you advocate for yourself, for your loved ones. Don't forget to take care of yourself. And during this pandemic, we've seen a lot of that. And we see this a lot in primary care, where women are busy taking care of everybody else. Have that happen to me all the time. I'm going to come back, doc, and take care of myself as soon as I'm done caring for X, Y, or Z in my family. And then it's 2 or 3 years later, and something has happened that could have been prevented several years before. So don't put yourself last on the list. And then when you've taken care of yourself, there are so many things that the COVID pandemic did show us that were positive in the way women helped each other, the way women reached out and helped those in the community that couldn't get vaccinated, that registered, that shopped for people. So if you want to make an impact, you should take care of yourself so that then you can help others. And I think there's so many ways that we can all address this issue together.
No, I think that is, as we say, that we can raise health for everybody. I'm going to end, though I could go on forever with this group, with a final question to each of you. Given the COVID pandemic, it's more important than ever for women to take positive steps, as we've discussed, for overall health and well-being. And Dr. Beran, tell me one thing that each woman can do, each of us can do to really raise health, something new, different, something we haven't discussed yet.
So I don't think this is new or different, but it's very important. And that's women need to take care of themselves. They need healthy habits. They need to make time to exercise, to eat healthy, for self-care. It is not a waste of time. You're entitled to it. You should do it. And it's really this, we saw during COVID that people with chronic conditions that were poorly managed did worse. So it's important that as we look at our own lives, that we address our own health, our own chronic conditions, that we take the time to get that managed. So many of us have put on the COVID-19. It is time to take the time to focus on yourselves and work on that.
No, that's fabulous advice. Dr. Jones, something new, different, one good piece of advice for us?
I have to agree with Dr. Beran. We have to take that time for ourselves, especially as women. A lot of people are working from home. So we're doing a lot more Zoom and team meetings, and they're being piled after each other, and there are no breaks. So we do need that yoga time, is what I call it, and even, or Zen time. So even if you take that time when you're going between meetings to just go to the ladies' room to get a fruit or something nutritious, it's extremely important that we just do that Zen time, even if you're counting from 10 backwards.
I like it. And some days you would want to go 100 backwards, right? Dr. Vincoff?
Yeah, I mean, I think, this has been a really hard year. And I think we've all learned the hard way, both women and men, about how vulnerable our health really is. I think a lot of people who didn't really think about their health are thinking about it now. And hopefully maybe the upside is that people will be encouraged to be more proactive about their health. On the other hand, part of me has seen that everybody seems to be a scientific expert now. And I think maybe if there's one thing that we hopefully will walk away from this with, is to respect science and to respect scientific experts, and to be very careful about your sources of information, and to realize that not all sources of health and science information are alike, and that it's worth taking the time to investigate and make sure that your sources are reliable.
No, those are three perfect pieces of advice. I'm going to add one from me on the last question. I think never to underestimate the importance of sleep. And it goes back to, being so busy for, taking care of everyone else and thinking you don't need it. There were years that it was sort of a sign of strength. I don't need to sleep. I do this, I do that. But the truth is, from a cardiovascular point of view, from a brain health point of view, adequate sleep every night is not a luxury. It is an absolute requirement. So I can't thank the three of you enough for joining me today. This was a really important and inspiring conversation. I imagine you'll each get phone calls to have new patients come join you and ask you more questions about today. I think the best lessons is that you are your best advocate. Becoming an empowered individual when it comes to your own care is important. Know your family history, get a list of your medication, find a doctor who really becomes a lifelong partner for you, and act on your instincts. I always tell women there's that little sixth sense that tells you when something is right or not right. You should always listen to that. Start your journey to better health through this advice from all of us. Start it today. So thank you all for joining us.
Welcome. I'm Emily Tisch Sussman, host of Your Political Playlist podcast. One of the most important stories of the pandemic is the impact on women and mothers. When schools and daycares closed, many women, including myself, had to find ways to juggle even more than we were already juggling. What became clear very quickly is this wasn't just a job crisis, it wasn't just a school crisis, This is a mental health crisis. As a mother of 3 young children, quarantining, remote learning, telehealth, and lots of anxiety and sleepless nights became the new norm. The never-ending question in my head and all of our heads, would my kids get sick? Would I get sick and pass it on to them? And for me, I was trying to record podcast episodes around my baby's nap time, still trying to do that. And I was doing them in a closet with pillows and blankets around me to absorb sound. And my struggles didn't even compare to many others. In February of this year, the New York Times launched The Primal Scream. It's a project where women could call in and tell their stories, or just scream, for 60 seconds.
Welcome to the New York Times Primal Scream line, where the floor is yours to yell, laugh, cry, or vent for a solid minute.
All I hear all the live long day is mom, 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 mom. I cannot remember the last time I did not worry. I did not spend my day worrying about so much stuff. Every day is something different. I just want to wake up and go through my day and not worry and not wonder and not know what the future holds, because this right here sucks and I'm sick of it. I'm so sick of this.
So today we're going to talk about the hidden mental health cost from the pandemic for all women. Joining us now is Jessica Grose, parenting columnist at the New York Times, who worked on The Primal Scream, Dr. Jennifer Kelly, the president of the American Psychological Association, and Cecilia Gentili, founder of Transgender Equality Consulting. Thank you all for joining us for this Women's Health Summit. Let's jump in. So Jess, what has the primal scream and more broadly this pandemic shown us about how society values mothers?
It's shown us that there is no infrastructure to support them. And that when society has a mega crisis that touches every corner, mothers are among the people who are tasked with picking up the pieces and supporting others who can't help themselves. So, I think we're still seeing the fallout from the pandemic, even as things open up a little bit. In many places, mothers still have disproportionate job loss. They are still doing the brunt of caretaking, both for their children, but also for other family members. And I think it's shown that they are just expected to be the safety net when no other safety net exists.
I think that really everyone can identify with that. And Dr. Kelly, I want to talk about the psychological aspect of this. We've ended up moving pretty quickly from like full lockdown to fully vaccinated and opening back up. And I think we're all kind of struggling with the emotional aspect of that we kind of got ourselves used to the full lockdown. Are there emotional tools that we can use to help integrate us back into society?
Yes, well, it all depends. So first of all, many people are expressing concern. The fact is that only about 1/3 of the adults are fully vaccinated, and many of those who are vaccinated are responding to that low number with concern. And so that is despite the release of the new CDC guidelines regarding mask wearing, who should and where to wear masks. And there is concern about vaccine hesitancy and that the numbers getting vaccinated are slowing down. So to be frank, they really do not know who to trust, as they feel that they are getting mixed messages. And so for the ones who are fully vaccinated, many are quite reticent to get back out into society. And so they have been traumatized by deaths, hospitalizations, and distress in the country. And it's been a year that's been punctuated by loss and grief, changes in the routine, working from home, especially for women, attending school online and having to take care of the children and being able to see the family and friends. And so the cumulative nature of these changes is leading to prolonged stress, for many Americans, and especially with women. And so these emotions just do not stop overnight. And it really takes time to move forward. So here are some emotional tools to deal with the reintegration into society. First is to just do what feels comfortable for you. If you feel more comfortable keeping your mask on, then do it. And as you see the numbers continue to decrease, then you may feel more comfortable going without it. And then, this is for the fully vaccinated individuals. The second one is on the shaping of the behavior. And so you can start small, such as not wearing the mask when you go outdoors, and then gradually increase your comfort level. And so one thing to keep in mind is that we have engaged in this social distance and the mask wearing for over a year now, and it will take some time to transition to the new behaviors, the new life.
Jessica, do you see this reflected in the primal screen? Like, is there the same amount of calls that you're getting in and the conversation has changed? Have they gone down? Like, what are you seeing?
I think the conversation has changed somewhat. I think people are somewhat more hopeful, but it really is so circumstantial. The moms who have more education, who are higher income, have frankly had a much easier time during this pandemic and continue to have an easier time. And the stresses that have piled up for moms with less support, whether they be single moms, whether they have job loss, those are lasting longer and they have not necessarily dug out from them. So it's really sort of across the board. And on a positive note, we just did a call out for moms who've made major changes in their lives because of realizations that they made during the pandemic. And so people have moved to new countries. People have, totally upended their lives. Some people have initiated divorces. So I think, in some circumstances, it has really put a spotlight individually on what isn't working for some folks in their lives. But in terms of the mental health impact, I think just as the doctor said, it's going to be a long time sort of digging out and getting used to, our new reality, which I think is not going to be identical to our old reality for quite some time. We still don't know. In New York City, my kids go to public school. We still have not been guaranteed that they are going to go back full time in the fall. In the way that they, once did. So I think there's just still a lot of open questions, a lot of changes that have not been good for everybody that I think moms in particular are dealing with.
And end up feeling like they take on the emotional piece for the family, like not just the actual logistics of it, but bear the emotional brunt of everyone in the family, I would imagine.
The cliche that I think has a lot of truth to it is you're only as happy as your most unhappy child. And I think a lot of parents, not just moms, a lot of parents take that to heart.
No, absolutely. We're in a relatively good situation compared to so many. And my most unhappy child developed a tic, like a twitch out of anxiety. And it was just heartbreaking. We do everything we can. But Cecilia, I want to bring you into this conversation. The trans community, especially trans women of color, have been long impacted by a lot of the issues that we're talking about more broadly for all women: job loss, discrimination in accessing healthcare, lack of access to resources. So how did the pandemic exacerbate these circumstances?
Yes, thank you for having me. Well, the trans community has a long history of mistrust and not really feeling comfortable with mental health providers. If you think of it's the mental health providers that usually had, for many years had to diagnose you with gender dysphoria and kind of like make sure that you are trans, right? So you can get your hormones. Or if you want to get a surgery, it's a mental health provider that, has those surgeries in your hands because are the ones that write those letters. The same thing to change your gender marker. So it is a history of like trans people and mental health providers, where mental health providers have held so much power over your persona in terms of getting what you need as a trans person, that we do not have the best history with these providers. So in the pandemic, it was like really hard to reaffirm the need for mental health services to the communities because of this mistrust that has been there forever. So, we, have tried to focus more in like peer support, in like kind of like getting together as a group of trans people to talk about what we are going through during these hard times. But it's also like, this understanding that everybody was going to be able to navigate virtual systems is not what happened, for example, with my community. Trans Latinas, we have seen many of the girls who have not been able to navigate virtual systems like Zoom meetings or like conference, video conferences. And many of the community, are used to like actually touch each other, like being in the same place, like breathing the same air. And they were not fully able to translate that into a virtual setting. And that has led to a lot of, depression, anxiety, suicidal ideation. And, we are, we have been hearing stories of people like really declining with their mental health, and like, not having a job. Jobs are not, something that is as easy for a trans person than it is for a cis person. And with this pandemic, many of the community members has lost their jobs, and many trans women, for example, have been forced to go back to sex work or to start doing sex work because it was the only way to make their living.
Because of the importance of peer relationships and peer support within the community of trans women, and the challenges that you named of moving some of those communities and supports to virtual, do you think that has impacted access to vaccines or considerations in wanting to get vaccinated and then be able to come in person? Or have people just kind of said they're going to take the risk and meet in person?
I have to tell you that both things had been happening at the same time. Before the vaccine or at the beginning of the vaccine, I saw a lot of people just taking the risk, right? If you had an opportunity to go and get a bag of food, people didn't think about it. They just put double mask and they went and got it. What happened that is good is that when the vaccines came about, most of the community were receptive to it. They got the message, like getting the vaccine means meeting in person again. And we were all craving that. We were all craving, like, I'm Latina. I need to hug and kiss and touch my friends and eat the same food, So when we hear about vaccines, we all talk about this is the way to get back to that. So we took risk when we didn't have vaccines. And for what I see, we are very much into getting vaccinated to recover all that sense of personal interactions in person.
Look, the Jews felt the same way about the hugging and the food. We need to do it. And Dr. Kelly, I understand that you conducted a series of town halls. Can you tell us what you found out from those? How are attitudes evolving now?
So we have done a series of town halls, and the most recent town hall occurred last week when we focused on some of the CDC guidelines and the changes with the mask wearing and being able to return to the work environment. And so what we're seeing is that people are hesitant still. And there's still confusion with the CDC guidelines. It's like, so what do we do and how do we do this? And the town hall last week actually focused on returning to businesses and how to look at things from a psychological perspective. And one of the things that we found is that the stay at home or the work from home did not have the same impact on various communities. So for example, people who felt like they were more marginalized within their work environment when they were on site felt more racial kind of disparities or harassment, felt more comfortable working from home. And now they have to make adjustments as the work site is opening. And how do you look at that from a diversity, equity, diversity, and inclusion standpoint, for example? So things that had never been discussed pre-pandemic are now coming out to light within the in the post-pandemic situation. And that was from that most recent town hall that we had. And we did have another town hall that really focused on the Stress in America survey, which we launched back in February, and it just showed the impact of this pandemic on people. And we saw that the communities of color were especially hit hard by this, and that so you had more weight changes with the Latinx community, the sleep challenges, and we found that more Black Americans, especially Black American women, were less likely to resume their activities when the work site, when the things would open back up again. And so we have to deal with that level of hesitancy. And so it's really, these town halls have really opened the door as to, for people being able to express some of the concerns that they're having about the pandemic and the changes not only on them personally, but in terms of their professional lives and with their families.
Well, I think the professional life is such a timely conversation as businesses are opening back up, particularly because we've seen the job loss numbers over the last year and hopefully starting to come back have really been women. That's where the jobs have been lost. That's where people have been forced out of the positions. And I think the sectors that were closed that we're hopefully going to see come back, retail, hospitality, childcare, are places where hopefully women will come back into the workplace and back into the workforce. But it's been a while and they may have some hesitancies they hadn't before. So your findings will be incredibly relevant for there. And you know,
can I just add one more thing? I'm sorry. One of the things that this survey did not show, or what we're not seeing from statistics, is the significant impact of the pandemic on the indigenous population, because their numbers are so low. And they have really been hit the hardest by the pandemic in terms of being infected by the virus and in terms of the deaths. And it's because of kind of like the structure, what you would see within that population. And I don't want us to lose that, especially the indigenous women and the impact of this on them. And that's been one group that's really been lost in terms of the impact of it on them. So thank you.
A great point. And, you know, something that I know that you've talked about before is on the emotional side. And we think about moving forward is that some communities, when they've been hit really hard by both infection and by loss, by death, that's taking a psychological impact on the communities as well. So I'd actually love for you to elaborate on this point that you've made before.
Yeah, so I think that the other part of that is that there's a lot of grief and loss there. And it's to some extent, the communities of color really have to go through this grieving process. And the interesting thing is that these communities of color we've had such big hits for that, but not like the rest of the population, or the white population, I would say. And so they don't really have the same level of understanding of what the communities of color have gone through. And they have to have patience with some of the anxieties that we have and the concerns, and have the patience with us, because I'm part of that community of color, in being able to move forward. And we have to have time to process all of these things that have happened to us and the changes that that have occurred within our community. And I can tell you that, you know, I'm a psychologist. And so in the work that I do, I'm now beginning to open it up a little bit, but I still have a tremendous amount of anxiety about opening up my practice, even with the mask wearing, because I have seen the impact of this on the communities of color and the patients that I work with. And so the patients that have not been as impacted, they just have to have patience with it. And if they can't, I can't have them in my practice, unfortunately, but that's the reality that I have to work within.
No, absolutely. And I obviously need to acknowledge that I work from home.
Yes.
So
Yay.
there we have it.
Hi, little one.
Do you want to wave? She's wearing her truck dress, her favorite dress. Timely segue, Jess, as we're thinking about, you know, as parents are thinking about, we're going into summer, different schedule, different routine. And even as you mentioned, starting to think about school for the fall, what are you hoping for parents? Like, what's the best outcome here?
Well, I think the best outcome for everyone is to keep everybody healthy. You know, that's the first and foremost goal, but part of that obviously includes mental health. And I think for kids this summer, what I'm hoping is that, you know, learning loss, while it's an important thing, I think for kids, they need joy in their life. They need play. And so I'm hoping that this summer they can focus on that and being outside where, you know, as we all know, virus transmission is lower, and getting that space to really be kids and be a little carefree. That's what I hope for the summer. I hope for the fall that kids can get back to safely. I mean, this has been so hard for teachers, and they've been working incredibly hard. And I have been just so impressed with my kids' teachers, how hard they've worked remotely and how much they are dialed into kids' emotional needs. So I think all schools across the country are really focusing more on social and emotional needs of kids, because that's something that, as Dr. Kelly mentioned, you know, especially communities of color that have had so much loss, you know, there's going to need to be healing for those kids, you know, who've had really sick family members, who have lost family members. That's not just something that you get over. And so as communities coming together, not just from, you know, families, but, you know, from the schools, from coaches, from all of these people in our children's lives that make such a difference, that's starting in the fall, where I really hope, again, that the virus stays at bay, that they can get back to those structures in their lives that help them, you know, heal and move through the world so much.
And I think the conversation ended up being framed, like the school opening conversation ended up being framed as like parents versus teachers, but a lot of teachers are parents.
They're trying to teach their kids and teach other people's kids, and you know, they are stretched so thin right now. And so my heart just totally goes out to them, and hoping that it gets easier for them come fall and is not just such a, you know, societal mess. But I think like that structural loss that is there for mothers is 100% there for teachers. We have not valued teachers the way that they should be valued. And if after this we don't value teachers, I don't even know what to say, because you know, 2 months of teaching my kids with no help before we moved. We had to move in with my parents to get extra support so my husband and I could keep our jobs. And you know, I always valued teachers, but having to do it myself, I value them 1,000-fold.
Well, I mean, I think, you know, moving in with your parents, like that was a story of our generation. And I think maybe even a little bit above us already, about being like the sandwich generation of taking care of our kids and our parents. And yes. I mean, basically everyone I knew who could move in with their parents did, for the childcare reason, like to be able to keep working for exactly that. And then had the additional concern for spread to parents, like COVID spread to parents, if they sent their kids back to daycare or back to school. Like that choice weighed on so many people, and everyone worked it out differently.
And, you know, I was actually thinking that exact same thing, because I know of people who've had children, young kids into the home that the kids went to school, came back with the virus, and the grandparents who were in the home ended up contracting the virus and unfortunately died. And so just think about the guilt that and how that weighs on the parents, and and how that impacted on the children in the home as well.
Cecilia, we're going into Pride Month, which is undoubtedly going to look a little bit different this year than I think it has in past years. And you've often said that life experiences are what drives your desire to ensure that everyone living on the margins of society is provided dignity and respect. So as we're going into Pride, and I'm sorry, she is just front and center right here. So, as we're going in, what would you like to see of cis allies going into this month? Like, it's going to look different anyway. So what do you hope to see this year? And
well, I want everybody to enjoy themselves, and Pride is a happy time. It's a moment of celebration. So I want everybody who identify as LGBTQI to just take time to be kind to themselves and enjoy the time. And for allies, what I want is to just share that joy with us. But what I ask for allies is to kind of redefine, have a seat with yourself, mm-hmm. and think about what allyship means to you, and redefine the word allyship. I mean, yes, putting a rainbow flag in your Instagram and say, yay, it's allyship. That's allyship. Yes, it's welcome, right? But think about what a real ally does. And for doing that is thinking about what's your privilege? What's your privilege of being straight? What's your privilege with being cisgender? What's your privilege with being a white person, for example, right? And how you use your privilege to support communities that identify as LGBTQI. Are you making an effort to hire a person who is trans? Are you making a small donation to an organization that does trans work? Are you mentoring somebody who is trans and trying to offer some of those skills that you have? Are you going to support a trans march event? So I still take the rainbow flag in your Instagram and I will celebrate it and I click like to it, but I'm asking you to do a little bit more, to check your privilege and see how you're using it to support LGBTQ communities that need it the most.
Well, this transition us perfectly to our last question. We just have about 3 minutes left. So just a quick answer from each of you around the horn. We'll stay with you. Cecilia, given each of your backgrounds, what's one thing that you hope that people have learned about women and mental health in this pandemic?
I hope people learn how strong we are, how resilient we are, and how much we drive everything in this world.
We make a t-shirt. I love it. Okay, Jessica, we'll come to you. What do you hope that people have learned about women in this pandemic?
I hope that they learn that they are relying on them to do the things that society won't do. Hope that, mothers themselves and anyone else who feels overwhelmed and burnt out knows that it's okay to ask for help, knows that it's okay to say, this is too much for me. I can't do all of these things, and to find help from family members and from spouses and from friends and from community.
And in my case, from this audience. Dr. Kelly.
Yeah. Well, I actually was going to say the exact same thing that Jessica said. Number one is that and number one is to feel okay about reaching out to others for support, and to really be in touch with where you are and when you feel like you need that support, and that know that there are people that can help you. And the other thing is that it's okay to seek mental health. And if you feel the need to be in touch with your emotions, where your emotional state is, because we know that women have been affected by this much more. I mean, this Stress in America survey showed that, and it's okay to reach out and get some help, because we are recognizing that more, and the help is out there. So feel okay about talking to someone when you need to.
Great. Thank you to all of you. I've really enjoyed this conversation to the extent that I can enjoy it. We found hope. No, no, we found hope, and I feel great about it. So thank you so much for your insights. And I hope everyone stays with us for the rest of this really great summit today at the 92nd Street Y. Thank you so much.
Hello, my name is Tina Conroy from the Center for Wellness and Integrative Medicine. I'm here today to share with you the benefits of Reiki and Reiki healing. I would love to share what Reiki is, as well as share an experience with you of self-healing. So first of all, what is Reiki? So Reiki is a modality, an energy modality that originated in Japan in the 1920s, but probably even beyond that. Reiki, like the word, Reiki, is Rei like the sun, and Ki, which is energy. And we are all made of energy. Energy flows through our body. At different times, the body can be blocked with energy. And different reasons for blockages could be emotionally, mentally, or physically. Reiki allows the body to come back to a natural state of healing. When you receive a Reiki healing, or even exercise a Reiki self-treatment, you'll feel the flow of energy. It will feel like a waterfall from the top of your head through your body. Some of the benefits of Reiki is that it promotes deep healing of calm, relaxation, reduces stress and anxiety. Some people have felt a decrease of pain. You don't have to be ill though for Reiki. I always say that it's like your car. So getting an oil change for your car keeps your car running smoothly. And don't we all want our bodies to run smoothly? I would love to share with you a little bit of self-healing today. As we begin, I invite you to place your hands on your heart. You may feel free to close your eyes or keep your eyes open at this time. Take a few deep breaths. And as you breathe in and out, take a moment to connect you to yourself. Let go of your day and bring yourself into this moment, present time. With your hands at your heart, feel this nurturing quality of your hands, the heaviness or the warmth. And as you breathe in and out, feel the comfort. Now imagine a beautiful waterfall of light from the top of your head that runs continuously down through your body, moving away anything uncomfortable. Perhaps it's thoughts, physical pain, or anything else. Gently keeping one hand on your heart, we move the other to the top of the head. And with this hand at the top of the head, this represents something bigger and greater, feeling this connection, consciousness. Take a few deep breaths here. Moving that hand to your forehead. The forehead represents trust, vision, what you see with your physical eyes and what you see with your internal eyes. Moving that hand to your throat, representing communication with self with others, and noticing the words that you speak to yourself. Changing those words to kindness and positivity. Moving that hand to your belly. And with the hands at the belly here, taking some deep belly breaths in and out. The belly represents your control and power. So many possibilities. Moving that hand finally back to the heart, the place of love and kindness and compassion. Bring compassion and kindness to yourself, always.
I preface this to say that I have a story. I tell it not because I think it's the most interesting story or it's a story that nobody's ever heard. I tell it because it's actually a story that so many people can relate to. Not the part of me being from a famous family, but the part about, you know, mental illness and suicides and you know, depression, anxiety, and all kinds of different things that have haunted my family for generations. And the reason why I tell the story was initially so that I could heal, because I think the beginning of finding a solution in the world of mental health, and especially for women, is sharing a story, finding somebody who will listen to you. It's so incredibly important to tell that story, get it out of you, because the moment that you've, you know, sort of said those scary things that are in our past, or the anxieties that you feel now in the present, when you release them, they have less of a hold on you. So, and so the reason I tell my story is to say, hey, we've all got a story. We've all come from something. You know, it's not been a picnic every single day of our lives for all of us. And I share my story because I do have the ability to have people listen, because I have some semblance of celebrity attached to my name and my image. But more importantly, it's just to say, hey, we're all in this together. I mean, the sort of the hashtag I've been using throughout COVID and how much we're all, you know, having to struggle and get through these anxious times is hashtag we got this, because together we've got this. And I really believe that storytelling, you know, telling our own story is part of the solution. The impact of mental health on my life has been profound. I mean, my oldest sister, who's 11 years older than me, when I was growing up, was at the beginning of having psychotic episodes, but unbeknownst to my family, she was schizophrenic, and nobody knew what that was at the time. So it was very frightening. And then there was just a lot of addiction in my family, a lot of alcoholism, but, you know, people were self-medicating because in my family, because nobody knew how to handle kind of what was going on with them. My middle sister, Margot, who took her life, suffered, you know, she was an alcoholic and she got into drugs and things, but it was all because she couldn't handle whatever it was that was inside of her. Very similar to my grandfather, this inability to like handle the inner pain. And my belief, and it is only a belief as I am not a doctor, but my belief is that when we have the courage to, you know, get up and say what's been going on, or where you came from, or what your history is that is kind of opening the shell so that you can dig deep and really find solutions to your problems. But, you know, I was affected as a kid, but of course, at the same time, that was my family. So I didn't know any different. I didn't know that it wasn't normal to have, you know, people drinking and throwing bottles and people getting cut, and craziness was happening in my family, but I didn't know another family. So I didn't know that that wasn't normal. But as I kind of got out into the world, and I was very fortunate to be able to make movies, and I made a movie called Manhattan. I was in, you know, I wasn't in my home environment in my little home, small town. I started to see that the world wasn't that wasn't normal. It wasn't normal that people fought a lot, and that there was a lot of screaming, and there was a lot of throwing of things, and a lot of deep pent up anxiety and fear. You know, I didn't know that that wasn't normal until I started to go out into the world. So running from crazy, people got a little bit, you know, like some people were up in arms, like I shouldn't have used the word crazy. But the truth is like sometimes we have to address the elephant in the room. You have to say what you're most afraid of. And I was most afraid that one day I would wake up, quote unquote, crazy, or, you know, imbalanced, or not right, or something. That was my biggest fear, because I saw my entire family kind of crumbling under the pressures of alcoholism and depression and all of that stuff. And I was so afraid that it was like a virus, like you could catch it. And then, you know, the years of trying to become more self-aware through holistic healing, through yoga, through meditation, through deep dives, through following all kinds of gurus and doing all kinds of things on every level, actually taught me a lot. But it also made me realize, I had a kind of an aha moment where I realized that, you know, the answers to all of our problems lie within ourselves. And when I came to that understanding, and I had tried many lifestyle things, many things that worked, many things I still do today, like meditation. I have a way that I know works for me of, you know, nutrition and eating that balances my brain. My exercise is incredibly important. Drinking water is important. Breathing techniques are incredibly important. I found my solution within life, within simple lifestyle choices. That's been my joy. But that running from crazy was literally because I was afraid that it would come on to me one day, until I really had an understanding about we are more than capable. It is within our purview to come to a resolution within our brains and bodies when you take in the whole of yourself. You tell the story, you look at your lifestyle, you look at whether you take time to meditate or pray or be in silence or whatever it is that you need to do that takes you into an inner space where you're stillness, literally, where you learn how to breathe. You do all these things because that leads you to a place where you feel that you are the person in control of your inner being. Now, we can't control the world. I mean, just like this virus has been very challenging on all of us, and we can't control that, but we can control what we eat. We can control how we breathe, and we can control whether we drink water rather than cola or alcohol or whatever, you know. And it doesn't mean that you never do those things, but it means that we can make different choices that affect the brain, because the brain is the main frame. So it being the main frame, what you do with the body is incredibly important to the balance of the brain. I would say to every woman out there, look at the habits that aren't serving you, and you know what they are. Don't act like you don't. first of all. Is that extra glass of wine really helping you? Is it really relaxing you? Or is it causing you more depression the following day, if you're really truthful? And I'm not saying everybody has to give up alcohol and never drink again. I'm saying be mindful of those choices you're making on a daily basis, whether it's alcohol, whether it's overeating, because, and women have this tendency, trust me, I know, I'm a woman, I've been there, we stuff our emotions. We literally put food in them, hoping that they will be stuffed away somehow. It doesn't work. It never has worked. So it's about finding balance in your life. And it's not about being extreme. I'm not saying this from a higher place than anybody else. I've been through my struggles. I've done all kinds of things, but I would say, please look at your lifestyle, simplify it, eat real food, learn how to breathe, learn how to maybe meditate or take some time of silence during the day. Try to get out in nature a couple of times a week, whether it's a walk on the beach or a walk in your backyard. Maybe go barefoot. That might be asking a lot of somebody, but truthfully, when you're grounding on the earth, literally like on your backyard in the grass or on a trail or at the beach, when you have your bare feet on the earth, the electromagnetic field of the earth is helping to release the overabundance of electrons in the body to help remove the neuroinflammation. And neuroinflammation is brain inflammation. So doing all of these things in lifestyle are so important, and especially for women. We're sensitive beings, we're dealing with families, we're juggling a lot of things. You're either juggling jobs and kids and what's for dinner and how to get the kids to different activities during the day. I get it. It's not always easy, but if you can control the lifestyle choices that you are in control of, you watch what your children eat, you watch what they watch on television. Be more kind to yourself in regard to what you're doing, because it's going to make a huge difference on how you feel mentally. So I'm a passionate believer that what we do every single day makes a difference in the balance of our brain. And that means from the simplest things to drinking water to the exercise you do. And it's not that you have to do a specific exercise, that you exercise at all, that you move, that you take time where you're not connected to technology. And I'm not saying, this is great. Here we are on Zoom. We've got all this amazing technology, but we need to learn when to turn it off. Turn it off when you go to sleep at night. You don't want those EMFs. I know you probably think I'm woo-woo saying those kinds of things, but they honestly affect the brain. They affect your sleep. Think about your sleep. Sleep is so important. So lifestyle, we have the ability to change those lifestyle things. We can eat a little bit better. Maybe you're not going to be a perfect eater, but you can do better. You can do better. You can make more organic choices. You can make choices of less processed food, because that is actually helping your brain. And I'm sure that most of the women out there are doing that for their families, and they need to do it more for themselves. And so, yeah, those lifestyle choices are just, I just think they're huge. It's changed my life. I used to suffer from some serious depression. And because of the food I eat, the water I drink, the breathing, the exercise, the getting sun, I get sun, not, I don't go in the heat of the day, but I watch sunrises and I try to watch sunsets as well. But I get up every morning and I watch a sunrise and I sit in silence for, and I'm not talking about hours at a time. I'm talking 5 to 20 minutes a day where you get that, the first sun of the day into your eyes, because actually your eyes absorb most of the vitamin D, and people don't realize that. So there's many different lifestyle choices that you can make that will make a difference in your life and to make a difference in your mental state. There's always going to be stigma and things that we're ashamed of and we fear. There's always stigma in fearful things that we don't understand. We stigmatize, we don't want to talk about it, we don't want to deal with it. But the truth is, the more you address it, the more you are honest about it. Because honestly, mental health, suicide, anxiety, depression, all of these things are more prevalent than most diseases. And so we really do have to address them. We really do have to quit being afraid to talk about it. Because I think if people really understand that everybody is going through something, everybody is. It doesn't mean that whatever we think we see on Instagram or Facebook, or all of our friends seem to be doing so well, they're partying all the time and life is just a joy and we've come out of COVID. There's a lot of people out there that are looking like that, but internally they're struggling, they're fearful, they've got anxieties. And so, it's about just saying, we're all in this together. Again, like I said in the beginning, if we all hold hands and we got this, we can do this together if you feel like you're not alone, because nobody out there is alone. We're all feeling bits of what everybody else is feeling. It's just the truth.
Hi, I'm Dr. Anna Costakis. I'm the Director of Adult Ambulatory Psychiatry at Northwell Zucker Hillside Hospital. And I am here along with my colleague, Dr. Fornari, to speak with you about the particular mental health challenges that have emerged from the COVID pandemic with which we've been racked for the last year. Dr. Fornari?
So it's a pleasure being together, and thank you, Dr. Costakis. I think that what we have learned during the past year, we really feel is important for us to speak about. And my name is Dr. Victor Fornari. I'm the Director of Child and Adolescent Psychiatry here at the Zucker Hillside Hospital and the Cohen Children's Medical Center, part of Long Island Jewish Medical Center and Northwell Health, and really appreciate the opportunity to talk about mental health during the pandemic. And I often tell people that it's hard to imagine that the psychological footprint of this pandemic will far exceed the medical footprint. And even though we know the medical footprint has been enormous in terms of the numbers of people impacted by COVID, the number of people hospitalized, the number of people who have died, the truth is that everyone on the globe is impacted by the psychological impact of the pandemic, and we certainly have been seeing that here in our work at Zucker Hillside. So we wanted to review some of really the more important lessons that we have learned that we really want people to understand and take away from this experience during the past year of the pandemic. And I suppose perhaps the most important place to begin is to recognize that the vast majority of people really have stepped to the plate, and the pandemic has brought out the best in people. And really, that's something for all of us to recognize and to appreciate. I know there's been a great deal of attention paid to all of the healthcare heroes and all the people who have worked courageously to really do everything that they can to help one another during this challenging time. And I think we all have to remember that although it's a stressful time, we can see the best of humanity during these challenging periods. And we've also learned something that we should know, but I think that the stressful lessons of the pandemic have reminded us, is that we have to take care of ourselves in order for us to be available to take care of others. And so self-care has been such an important lesson that we've learned, certainly for everyone. We healthcare providers have recognized the impact of all the stresses that the pandemic has brought to our professional lives and our personal lives, and recognize that for everyone, self-care really is now a personal responsibility, and for those in healthcare, a professional responsibility. And that's something that we really have to be mindful of, that it's not selfish to say I have to take care of myself. It's really our personal responsibility. And certainly if anyone's been listening to the news and reading the news, we know that the levels of anxiety and depression have really increased dramatically across the board, across all age groups. And we've seen this, and of course we understand it, because the pandemic really has kindled worry. People are worried about fear of contagion, fear of the loss of loved ones, concerns about their livelihoods. And so anxiety is in so many dimensions. And we know that anxiety and depression is dramatically increased, and really is something that we should recognize, because it's now practically normal. And we have a particular duty to realize as a take home that children have been impacted in a very particular way, because school is their work, and missing out on the normal routine of school for those kids who have been out of their school and doing virtual education has really been a particular challenge, and placed children and adolescents in a very unique position to feel isolated. And we've seen nationally across the board about a 40% increase in the request for mental health services for youth. And we've seen that in emergency rooms across the country, with high rates of children who are depressed and anxious. And we've seen that in all of our clinical services. And so now as we re-enter, we recognize that the re-entry also comes with anxiety, because we've now become accustomed to be working from home or learning from home, and re-entering brings with it new challenges. And so we'll see how we can best help everyone to make that readjustment back into returning to a new normal, but hopefully for children and adolescents, school on site. And in addition, we want us to remember that in the same way that the pandemic has brought out the best of humanity, that the vast majority of the population will be resilient. So even though anxiety and depression is dramatically increased, that over time, resilience will be the rule. And we just have to remain optimistic and hopeful, because we do know, based on previous experiences of extreme stress, that the population generally will be resilient. Dr. Costakis?
Yes, thank you. And, along with what Dr. Fornari mentioned, absolutely. So unfortunately, depression and anxiety in our population have become the new normal. So a silver edge, right? An edge to the sword here is that this might be what we need to be able to destigmatize mental illness. If the vast majority of the population is struggling with depression and anxiety, then this is the new normal. We've had quite a bit of time to do studies across the world, UK, US, and the numbers are astounding and pretty consistent internationally. That in the period July 2019 to March 2020, In the UK, about 10% of adults experience depression. In the US, about 11%, so very comparable. And then in June 2020, that rose to 19%. And that was early in the pandemic in the UK. And by December 2020, US adults reporting symptoms of anxiety and depression were 42%. So very much nearing the halfway mark of the population. And again, consistent internationally. Another study showed that compared to that average 11% in 2019 of everyone across the board, adults having anxiety, reporting any symptoms of anxiety or depression, compared to 41% in another survey. So very clearly, this is becoming the norm, and it should be a regular conversation for us to check in on each other's mental health and really, just like Dr. Fornari said, working on our own self-care and monitoring of those symptoms. And in addition, we've really seen through a lot of research that the pandemic brought out some significant social inequities in access to healthcare. So mental health care is really no exception in that. And in terms of coping, adapting, recovering, all of this has been more difficult for marginalized populations, compounded with the difficulty in accessing healthcare and mental health care. And a lot of studies, there was a study that came out from the CDC in August of 2020 that really emphasized the high rates of anxiety, depression, increased substance use. 1 in 10 adults reporting that they started or increased substance use because of COVID-19. Marked increase in serious considerations of suicide. And all of those rates were specifically much higher in young adults, Hispanic persons, Black persons, essential workers, unpaid caregivers for adults, and those with pre-existing psychiatric conditions. So those who are vulnerable already have become even more vulnerable, unfortunately. And many of us can relate to this. Women and parents have had a particularly difficult time this past year. I'm sure it is not an unfamiliar feeling for many of you to be on a Zoom call in the context of work as a woman or parent and having the sound of children in the background, which normally would never happen, but juggling work and home has become not an exception to the rule, but an everyday struggle for pretty much most households. In those households with children under the age of 18, the rates of anxiety and depression in adults is also significantly higher. So in those households, compared to that average that we saw, 41%, women have 49% higher, 49% rates of anxiety, depression, and the men in those households, 40%. So significantly higher. And for women, in general, women have had higher self-reported levels of stress, anxiety, depression, post-traumatic stress symptoms. Women who are pregnant, postpartum, miscarrying, or experiencing intimate partner violence are especially high risk for mental health problems in the pandemic. Social support here is key. Those gender disparities really have heightened in the course of the pandemic, and employed women, single parents, and women responsible for the bulk of the domestic tasks have taken a significant hit in terms of their mental health and their daily stress. So just to be aware that there are some warning signs that despite this being the new norm, there are warning signs that you need to seek out more support. So for instance, eating or sleeping too much or too little, isolating despite the opportunity now to connect with others, your energy being too low or too high, having all sorts of unexplained aches, pains, feeling hopeless or helpless, increased substance use, not being able to manage your constant worries, feeling guilty all the time, thinking of hurting or killing yourself or someone else, and really feeling like the demands of work, home are too much to be able to manage. And so Dr. Fornari and I would like to make sure that you all know that we in the Department of Psychiatry at Zucker Hillside are here to assist, both from the child side and the adult side. And so from the adult side, I will tell you that we have a walk-in clinic, the crisis center, and that is easily accessible. If you Google the Zucker Hillside Crisis Center, we actually will be starting next week. You can book your appointment directly online, or just walk in 9 to 3, Monday to Friday. We have a huge outpatient department where you can access various services from therapy, medications, whatever the need. And then Dr. Fornari, maybe you can tell us a little about the resources available for the kids.
Thank you, Dr. Costakis. Similarly, we have created urgent care walk-in services over the last several years at the Cohen Children's Medical Center, where somebody can come Monday through Friday, 9 a.m. to 3 p.m. without an appointment, although also you can book online as well, but you don't need to. You can walk in and receive a comprehensive evaluation and a referral for treatment. And we have a range of outpatient mental health services that can provide group therapy, individual therapy, as well as medication management as clinically indicated. In addition, we have an emergency service, 24 hours, 7 days a week, that's available if someone needs urgent care or emergent care, and it's not in the window of Monday through Friday, 9 to 3, at any time can come to the emergency room at the Cohen Children's Medical Center to receive emergency evaluation for children and adolescents. And we really have seen a dramatic increase in these services and recognize that it really is a safety net, and want to encourage people to please take advantage, because children who have been vulnerable really do need the care that they can receive there.
And if you're lost trying to figure out which direction to go or want to speak with someone to be able to get triaged, we do have a specific warm line set up in our clinic. And one of our social workers will call you back within 24 hours to be able to triage and help you link. That number is 718-470-8428. And you will receive our caring voices at the other end of the line, and hopefully be able to link you with the care that you need. Just knowing that across the board, we are all here to support you, and whatever support you might need, or even questioning whether you need support, reach out to us. It's better to ask than to try to figure it out on your own and see if this might pass. We're all in this together.
Dr. Costakis, I think similarly, if anyone wishes to call child and adolescent psychiatry for any information or referral, you can call 718-470-3500 and explain the situation, and we'll refer you to the appropriate clinical services. So we thank you for your attention. We hope that this information is useful. We hope each of you and your family members are well and you stay safe during the pandemic. And remember that the rule is resilience, but if impacted, we urge you all to do self-care and take care of yourselves and your loved ones. Thank you.
Thank you.